Welcome to this session on systematic reviews and critical appraisals. Reviews of research are not necessarily rigorous or explicit in their methods of review. Most reviews of research take the form of traditional literature reviews, which usually examine the results of only a small part of the research evidence and take the claims of authors at face value. The key features of a systematic review are that explicit and transparent methods are used. It is a piece of research that follows a standard set of stages, and it is accountable, replicable, and updatable. Systematic reviews use an objective and transparent approach for research synthesis with the aim of minimizing bias. While many systematic reviews use quantitative methods, there are also qualitative reviews which adhere to standards for gathering, analyzing, and reporting evidence. Using critical appraisal skills and tools enables users of research evidence to reach their own judgments. I want to start off with an example of a review that I wrote in 1994. At the time I wrote this review for the World Health Organization, I had never heard the phrases systematic review, narrative review, or critical appraisal. Nowadays, we would call this a narrative review, although it is in part systematic. As you can imagine, this was quite a daunting task. I started off in a big room at the World Health Organization headquarters in Vienna with lots of documents in cardboard boxes, what we would nowadays call the grey literature. I also had access to a primitive search engine. What I tried to do was to be as comprehensive as possible and also to identify critical issues. I'd already written a few papers, so I knew that critical appraisal was important, but I had no guidelines to follow. Here we can see some of the issues I addressed in the report. The study covered a wide range of disciplines including epidemiology, toxicology, psychiatry, pathology, law, and sociology. Details of over 100 studies published between 1985 and 1993 were obtained through an online computer search of the Bath Information and Data System, as I mentioned earlier, a primitive form of search engine. These papers, together with the surveillance data that I had, provided extensive data to summarize and review. However, as virtually all substance abuse-related material related to the developed world, a further search of published abstracts from the international AIDS conferences was also conducted, and a number of further studies were found by this method. So one of my objectives was, first of all, to tell the reader where all the information came from for the report. One of the issues that I looked at was methadone maintenance treatment. Although methadone maintenance treatment has periodically been criticised, there is widespread acceptance of its role in reducing mortality. However, the literature review revealed only 2 studies, both from Sweden, which directly assessed this issue by means of a randomised control study and comparison with street addicts. The widespread adoption of MMT in other settings, however, may not always be so beneficial as indicated by study C in Table 5 in this slide. This was an attempt to critically appraise the literature. The medical literature is huge and growing at an explosive rate. According to a 2010 study, there were 75 clinical trials and 11 systematic reviews published every day. A quick PubMed search found over 17,000 papers published with clinical trials and nearly 8,000 with primary care in abstracts in 2013 alone. With these kinds of numbers, the prospects of keeping on top of new publications seems daunting. Also, we like to imagine that medicine is based on evidence and the results of fair testing and clinical trials. In reality, these studies are often flawed in many ways. We like to imagine that doctors who write prescriptions for everything from antidepressants to cancer drugs and heart medication are familiar with the research literature about a drug, when in reality, much of the research is not easily accessible. And that is the topic of this book by Ben Goldacre here. Okay, let's have a review question. The review question is, to read the literature critically means A, to suggest the previous research was always poorly conducted. B, skimming through the material because most of it is just padding. C, evaluating what you read in terms of your own research questions. Or B, being negative about something before you read it. So to read the literature critically means evaluating what you read in terms of your own research questions. Not all of what you read will be relevant to your task, so you must have a clear focus on your research questions as you read. Critical means in this sense using your intelligence and judgment, and as we discussed previously, you need to understand the concepts being used in the papers that you read. Let's look at an example of a systematic review. This one is called a systematic review of research examining benzodiazepine-related mortality, published in 2009. And the research question aim states that due to a dearth of literature and difficulty in distinguishing between illicit and non-illicit use of this widely used prescription medication, the systematic review was extended to include both prescription and non-prescription use of illicit drugs. And the aim of the paper is to examine whether there is evidence of elevated mortality risk among heavy or dependent benzodiazepine users. And here we can see that an example of the papers that were used in the study using the PRISMA flowchart, which we'll look at in a bit more detail, but this is very typical of systematic reviews, where we start off with many papers and then we filter them for a variety of reasons, and then we're left with the ones that we subject to more detail. So in this particular case, it starts off with over 9,000 papers, but only 9 end up being used in the systematic review. An important part of any systematic review is the search strategy. And this slide shows the terms used in the search strategy. And later on, we'll talk about how you go about formulating a search strategy in terms of keywords or phrases. The paper states that an extensive literature review was undertaken using different databases, Embase, PsycInfo, and Medline, to locate all papers on the topic from 1990 onwards. So after sifting through the papers and excluding the vast majority because they weren't benzodiazepine focused or they didn't have the necessary data on mortality, the authors were left with 9 studies, 6 cohort studies and 3 retrospective registry studies. And the results are shown here. Basically, they were mixed. Some did show an association, some didn't show an association. And they concluded that on the basis of existing research, there is limited data examining the independent effects. And this is a key point. Many studies do show that there is a relationship, but can we really say that it's to do with the benzodiazepines and not to do with other factors? And they go on to say that future research needs to be done. Essentially, there wasn't enough control over both the independent variables, the recording of benzodiazepine use, and also the outcome variables, the recording of mortality. So there's a lot of detail within the review discussing the strengths and limitations. In the commentary on the paper here, it states that the authors did not state any implications for practice, and the author stated that further research needed to be done, including randomized control trials, which is something that's very unlikely to happen. More generally, we need to think about what were the criteria used for analysing these studies. How did they interpret and analyse the data? The first thing that we will do is look at how the results are reported in a systematic review. So here we can see a table from the papers, and it's of the 6 cohort studies. You can see the reference for them, you can see the location, different locations, Norway, Netherlands, etc. You can see a quality score, which we'll look at in a little while. You can see the score. The range is actually 0 to 18, so the higher number being an indicator of higher quality. So the Kripke study has the highest quality. We can see the sample who were studied. We can see that there's different populations. So this one's population aged between 40 and 42, whereas this one is a study of people aged over 85. So quite, different populations, which obviously makes it difficult to draw conclusions. Great difference in sample sizes, going from 500 to over 1 million. In terms of follow-up, we can see there's different periods of follow-up, definitions of drug use, and the estimates. So the key thing here is what's the estimate of risk, and in this case it's hazard ratios with a value of 1 indicating no difference, a value above 1 indicating that there is an association with benzodiazepines, and we can see the confidence intervals for the population. So it's important to in order to analyze a paper, we need to be able to extract and understand all this kind of information. So in the previous slide, we saw that it talked about the quality index, and I've divided this into 2 slides just to go through it in a bit more detail. So you can see that you can get scores, you can get points according to how well the study meets these quality indices. So for example, if we look at case ascertainment to begin with, you get a score of 0 if it's just a convenient sample where the representativeness of the sample is unclear. If it's restricted to one city, you get 1 point. If it's, for example, a random sample, but representative sample of the population, then you get 2 points. And if it's all cases from a geographically defined population, then you get 3 points. Okay, and if we look at how is the drug use measured? Again, no points for not specified. Dependence assessed via structured interview, 2 points, and so on. We can see another one here. The estimate, the type of estimate, was if we have if the crude mortality rate is not given, then it's no points. If there is a crude mortality, 1 point, and same for standardized mortality. So you can see that's part of the way in which quality is. And it goes really into quite a lot of detail. So this variable here, the description of it is where the numerator and denominator based on identical epochs, time periods, and identical catchment areas for estimates of interest. And again, we have no and yes. We also have a variable that looks at complete list. Does the study report response rates and attrition rates, and so on. So you need to pay quite close attention to a paper in order to be able to extract this information and assign a possible score out of 18. As we've seen already, the results from the cohort study were mixed and inconclusive. Some studies showed an increased mortality rate. Others showed a positive association among females in a middle-aged population, and Kripke found significant relations between mortality and sleeping pill use, particularly among older age groups. A dose-response relationship with frequency of use was also found in one study, which supports the previous findings that I've mentioned by Kripke et al. Taken as a whole, the authors state that these factors make it difficult to show cause and effect relationship between benzo consumption and mortality, and the data cannot be considered as anything other than exploratory. They go on to say that the true relationship between benzodiazepine use and increased mortality is still very unclear. Questions remain about effect size, interactions with age, and confounding, particularly anxiety and other psychiatric disorders. So you can see that in order to do and interpret a systematic review, you need to have quite a lot of knowledge of the topic. A review question now about literature reviews. What can a researcher use the literature to achieve? Demonstrate competence by referring to prominent writings. B. Develop their version of the literature in such a way as to show and lead up to the contribution they will be making in their own project or article. C. Identify a gap or problem in the literature that corresponds to the research questions. Is it one of those or is it all of those? So a good literature review will do all of these things. It will demonstrate competence by referring to the prominent writings. It will develop your version of literature review in such a way as to show up and lead to the contribution that other papers will make in relation to your own project. And it will identify a gap or problem in the literature that corresponds to the research questions. A systematic literature review is which one of the following? One that generates a literature review using a treasure hunt system, a replicable scientific and transparent process, one that gives equal attention to the principal contributors in an area, and a manufactured system for generating literature reviews tailored to your subject. So which one of those is it? So a systematic review is a replicable, scientific and transparent process. A systematic review tends to reduce researcher bias, and the process obliges the researcher to be more comprehensive and thorough. For report writing, this would mean explaining your research choices, followed by a write-up of the methodology used. This is a long way from simply going online and accepting what pops up in a Google search. So the systematic review on benzodiazepines that we talked about was certainly part of the motivation for the study that we did a few years later in 2014. And we hope to overcome some of the major limitations which relating to measurement of the exposure, how much benzodiazepines. So as I previously mentioned in another session, we didn't just count prescriptions or rely on self-report. We measured the amount of drugs using defined daily doses. And we tried to eliminate confounding by using a wide range of variables. So we measured various psychiatric illnesses, which had been thought to be some of the big confounders. So you can see how our research question, which we used to develop a study protocol, built very much on the review that was available to us at the time. We've looked now at a couple of reviews. Let's go back and look at the process and the stages involved in a bit more detail. This picture from the Cochrane website shows the stages. The Cochrane website is devoted to systematic reviews, and you can see the different stages involved: determining the research question, writing the protocol, searching for studies, sifting and selecting the studies, extracting the data, assessing the quality, combining the data, discussing and concluding the overall findings. So there are many stages involved in the analysis. It's difficult to say how long systematic reviews take. There have been some estimates in the literature saying that they take anything from 6 months to 2 years, while another paper has shown that rapid reviews vary from 7 months to 12 months. However, it very much depends on the type of question that you are asking. So systematic reviews are near the top of the evidence pyramid. We previously looked at case control studies and cohort studies, and these are from individual samples. Randomized controlled trial adds the element of people being randomized, so that's why it's higher up the pyramid. Systematic reviews are higher up still because they're taking the results of several studies and combining them. And then at the top, we have meta-analysis, which is where we go beyond a systematic review by introducing an attempt to quantify the effect of an intervention. So it's important to frame your research in the form of a question. So for example, the one that we looked at previously asked about what's the impact of benzodiazepine use on mortality. But even that is not a particularly precise question. There's licit use, there's illicit use. So there's different ways of framing the question. And we also need to think clearly about inclusion and exclusion criteria for the studies. And for that, we might want to think about some of the quality indicators that we previously looked at. What kind of analysis did they do? What kind of outcomes did they have? But by framing a research question to begin with, this will help you stay focused in searching and only gathering the information you need to accurately and thoroughly answer the research question. The first step in a systematic review will involve setting up your search terms. And we can use both controlled vocabularies and keywords. Controlled vocabularies are the more formal terms that are used to tag articles. Keywords are more based on everyday language. All databases are more easily searched if you think of the terms that represent each idea in your question prior to searching. A controlled vocabulary is a carefully selected list of words that are used to tag information in a file so that they can be more easily retrieved in a search. But whatever you do, it's important to keep track of your searches and results every step of the way in a systematic review. And there are various tools that you can use to do that. One of them is the PRISMA guidelines, the preferred reporting items for systematic reviews and meta-analysis. And this includes a flowchart that should be included with your review, which maps the results found, how many excluded, what the reasons were for excluding them, the reasons for the decisions made, etc. And a spreadsheet in Excel can also help you to keep track of your workflow. Here we can see the distinction between controlled vocabulary and keywords. The distinction is that controlled vocabularies are predefined and only searches the subject or descriptor field in a database record, such as keywords, for example. And this results in results that are usually relevant to your topic, and it could narrow your search, providing fewer results. But it's less flexible. It's only available if there are predefined subject headings. So here's some examples. For example, skin neoplasms might be part of the controlled vocabulary, whereas if you search for skin cancer, you might get far more results. So it's more flexible as shown here, but on the other hand, you can get results that may not be relevant to your topic. If you do a systematic review, it's a good idea to keep a database, for example, in the form of an Excel spreadsheet that records all these various parameters. This will help you to report the results, and if you need to change it, it also allows other people to look at all the steps that you've done. Here we see an example of a PRISMA flow diagram that are usually reported in systematic reviews. This is why it's important to keep a record of how you've gone about your review process. You can see here all the stages of where papers are identified, removal of duplicates, removal of papers that were not relevant for a number of reasons, and then the number of papers that are left in the review. So flowcharts are an integral part of systematic reviews. There's also a PRISMA checklist which helps authors to improve the reporting of systematic reviews on meta-analysis. While the focus is on randomized controlled trials, PRISMA can also be used for other types of interventions. PRISMA may also be useful for critical appraisal of published systematic reviews. However, it's not a quality assessment instrument to gauge the quality of a systematic review. Here's an example of some of the items from the PRISMA checklist. So for example, when we look at study selection, item 17, we can ask whether the paper, this review gives the number of studies screened, was there an assessment for eligibility, with reasons for exclusion at each stage, ideally with a flow diagram. If we look at item 19, for example, risk of bias, did they present data on the risk of bias of each study, and if available, any outcome level assessment. 23, did they give additional analysis, for example, sensitivity or subgroup analysis? So this is a really useful checklist for going through to assess a study. Going back to the issue of creating a searchable question, which is the most fundamental thing to think about, a very useful method is the PICO method, which you've probably come across, but it stands for patient or population, intervention or indicator, comparison or control, and outcome. So if we take a research question like the one shown here, we can break it down into these four stages, which will help us in creating a searchable question. So for example, if the background is a 28-year-old male presenting with recurrent furunculosis for the past 8 months, these episodes have been treated with drainage and several courses of antibiotics, but keeps recurring. And he asks if recurrences can be prevented. So we can convert this into PICO using the method shown below. We can see the population of interest, patients with this condition, the intervention, prophylactic antibiotics, comparison, no treatment, and the outcome, reduction in recurrence rates of furunculosis. So that's a good method for breaking down a question into a searchable question that we can use in a review. Thinking about systematic reviews, which one of these is a limitation? Is it that they're too hard to do, that they're not suitable where research questions are not capable of being defined in terms of a particular variable, C, that they're particularly complicated, or D, that the research community finds them too complex? So the limitation of a systematic review is that they're not suitable where research questions are not capable of being defined in terms of the effect of a particular variable. We talked earlier about controlled vocabularies, and one of the best known controlled vocabularies are the medical subject headings, which are used in PubMed. So the Mesh browser is an online vocabulary lookup aid available for use with the medical subject headings. The mesh-controlled vocabulary is a distinctive feature of Medline. It imposes uniformity and consistency to the index of biomedical literature. Mesh terms are arranged in a hierarchy called a mesh tree. Mesh terms are labels assigned to each article in Medline in order to describe what the article is about. The National Library of Medicine employees with training as indexers look at each new article added to Medline and assign to it about 10 to 12 labels which best describe the content of the article. And here we can see an article and we can see the mesh terms that have been assigned to it. Mesh terms are organized into a hierarchy called the mesh tree. For example, if you were to search for diabetes, you would see that there are several subtypes of the disorder. And if you expand your mesh term, all the subtypes will be included in the search as well. So here we can see an example of the mesh tree with the category of congenital abnormalities and then subcategories shown here. Mesh provides two tools to help authors select mesh descriptors as keywords for articles. First, Mesh on Demand. This tool can automatically identify relevant mesh terms from text, such as an abstract. It uses natural language processing to find mesh terms. Second, there's the mesh browser. This tool allows users to search directly for mesh terms. So the mesh headings is one example of a controlled vocabulary. It can be used while searching the Medline database via PubMed. As we've seen, subject headings are applied to every article indexed in PubMed to identify key topics. The mesh database allows you to search for the controlled terms using keywords and build a search to use in PubMed. So let's use Mesh on Demand and see what happens. I've just typed in one word here, addiction, and then press search, and what happens is it comes up with mesh terms on the right hand side and also additional terms. So it's come up with behavior, addictive and substance related disorders, and it also provides a list of relevant articles down here. This time we're using the mesh browser and I've typed in the word addiction. When I click on exact match, nothing comes up, so I changed it to all fragments, and you can see below it produces 11 records, and you can see the headings that it produces. So the first one it produces is addictive behavior, and then there's some other ones lower down. So you can see the way in which the mesh browser works. This slide shows links to online resources available at Keele. If you search for books or more, or articles and more, that is most reflective of what Keele actually owns or subscribed to. Books or more includes books, ebooks, thesis, DVDs and physical items. Articles or more includes online articles from peer-reviewed journals, industry journals, newspapers and other full-text resources. We will now consider three resources: PubMed, sometimes called Medline, Web of Science, and Google Scholar. This slide shows some of the resources that can be accessed via the life science pages of the Keele Library, including Medline and Web of Science. The first thing to note is that PubMed and Web of Science are human-curated databases. Google Scholar is not. Journals are the focus of Web of Science and PubMed, and they are selected for inclusion by humans based on scholarly and quality criteria by literature reviews committees. PubMed focuses on clinical and biomedical literature. Web of Science is interdisciplinary and includes the best journals of each subject area. Medline is the National Library of Medicine's premier database and contains more than 28 million references to journal articles in life sciences with a concentration on biomedicine. A distinctive feature of Medline is that records are indexed using the medical subjects headings mesh, which we will talk about later. Note that PubMed only includes open access full-text articles. Google Scholar searches full text of articles, but PubMed and Web of Science search only the citation, abstract, and tagging information. If you want an article that's primarily about a specific topic, the information will be in the abstract. Web of Science and PubMed give you much more search functionality than Google Scholar. So if you want to do more complicated searches using and or, etc., and you want to find ways to refine your search, I would use these rather than Google Scholar. There is an advanced search option on Google Scholar, but it's primitive, hence you often get very large number of results using Google Scholar. This slide shows a summary of the three databases: PubMed, Web of Science and Google Scholar. If we start by looking at what's included, we see that PubMed only includes journal articles. Web of Science includes journal articles and conference proceedings, and Google Scholar includes anything online deemed scholarly, including the grey literature. If we look at the key features, we can see that PubMed includes popular biomedical journals, including clinical and biomedical sciences. Web of Science covers all sciences and health sciences, and Google Scholar searches across all disciplines that are deemed to be academic. And if we look at the criteria for inclusion, we can see that for PubMed, scholarly and quality criteria are determined by a literature review committee. For Web of Science, scholarly and quality criteria determined by a literature review committee also must fit the subject matters trying to find the best in each field. And Google Scholar is machine automated criteria for information provided by publishers or individuals.